Hello everyone, this is Chris in Geneva. We're just going to do a very quick audio test with Dr. Mary-Paul Keeney. Can you hear me okay, Mary-Paul?
I hear you perfectly fine.
Thank you, Mary-Paul. We hear you well. And we'll just do a very quick test with Dr. Michel Yao joining us from Guinea. Do you hear me, Michel?
Yes, loud and clear. Thank you.
Thank you, sir. Welcome. And thank you for joining us.
Thank you.
And if we can also do a very quick test to Dr. Sose Fall. Do you hear me, Dr. Sose?
Hi, Chris. I can hear you. Can you hear me?
I can hear you and I can see you well. Thank you, sir.
Hey, Marie-Paul.
Merci.
How are you?
Such a pleasure to see old friends.
A pleasure, yeah.
Hello and good day to wherever you are listening.
Bonjour, où que vous soyez, nous sommes vendredi 5 mars 2021, je m'appelle Christian et je vous souhaite la bienvenue au cours de cette conférence de presse de la Covid. Nous avons une interprétation simultanée dans les 6 langues officielles des Nations Unies, l'arabe, le chinois, le français, l'anglais, l'espagnol et le russe, ainsi que le portugais.
We'll have a special guest that Dr. Tedros will introduce to you shortly. Present in the room today are Dr. Tedros Adhanom Ghebreyesus, WHO Director General, Dr. Mike Ryan, Executive Director of WHO's Health Emergencies Program, Dr. Maria van Kerkhove, Technical Lead on COVID-19, Dr. Mariangela Simao, Assistant Director General on Access to Medicines and Health Products, Dr. Soumya Swaminathan, Chief Scientist at WHO, Dr. Bruce Aylward, Special Advisor to the Director General and Lead on the ACT Accelerator. Online, we further have Dr. Sose Fall, Assistant Director General for Emergency Response, Dr. Michel Yao, Director for Strategic Health Operations, and Dr. Peter Ben Embrek, the WHO expert on food safety and zoonosis and international lead of the WHO-convened global study of the origins of SARS-CoV-2. Without further ado, let me hand over to Director General for the welcoming remarks.
Thank you, Christian. Vielen Dank. Good morning, good afternoon, and good evening. As you know, this was a landmark week for COVAX, with the first vaccination starting in Ghana and Côte d'Ivoire. In addition to those two countries, COVAX has now delivered vaccines in Angola, Cambodia, Colombia, the Democratic Republic of the Congo, the Gambia, India, Kenya, Lesotho, Malawi, Mali, Moldova, Nigeria, the Philippines, the Republic of Korea, Rwanda, Senegal, Sudan, and Uganda. In total, COVAX has delivered more than 20 million doses of vaccine to 20 countries. In the next week, COVAX will deliver 14.4 million doses to further 31 countries. That brings the total number of countries to 51. Earlier this week, COVAX published the first round of allocations, covering the majority of economies participating in the COVAX facility. This is encouraging progress, but the volume of doses being distributed through COVAX is still relatively small. The first round of allocations covers between 2 and 3% of the population of countries receiving vaccines through COVAX, even as other countries make rapid progress towards vaccinating their entire population within the next few months. One of our main priorities now is to increase the ambition of COVAX to help all countries end the pandemic. This means urgent action to ramp up production. We currently face several barriers to increasing the speed and volume of production of vaccines, from export bans to shortages of raw materials, including glass, plastic, and stoppers. WHO is working on 4 approaches. The first and most short-term approach is to connect companies who are producing vaccines with other companies who have excess capacity to fill and finish. This could help to speed up production and increase volumes. For example, part of the deal between Johnson & Johnson and Merck announced this week is for Merck to provide fill and finish for the J&J vaccine. We need more partnerships like this, and we need them in all regions. WHO can support this process by identifying gaps and providing a matchmaking service between vaccine producers and companies with capacity. The second approach is bilateral technology transfer through voluntary licensing from a company that owns the patents on a vaccine to another company who can produce them. A good example of this approach is AstraZeneca, which has transferred the technology for its vaccine to SK Bio in the Republic of Korea and the Serum Institute of India, which is producing AstraZeneca vaccines for COVAX. The main disadvantage of this approach is the lack of transparency. The third approach is coordinated technology transfer. This would involve universities and manufacturers licensing their vaccines to other companies through a global mechanism coordinated by WHO, which would also facilitate the training of staff at the recipient companies and coordinate investments in infrastructure. This provides more transparency and a more coherent global approach that contributes to regional health security. And it is a mechanism that would increase production capacity not only for this pandemic, but for future pandemics and potentially for the production of vaccines for routine immunization programs. In fact, WHO has done this before. After the spread of H5N1 influenza in the mid-2000s, WHO supported technology transfer for the production of pandemic flu vaccines to 14 countries, increasing global capacity by more than 700 million doses. And fourth, many countries with vaccine manufacturing capacity can start producing their own vaccines by waiving intellectual property rights, as provided for in the TRIPS agreement. Those provisions are there for use in emergencies. If now is not a time to use them, then when? This is unprecedented times, and we believe, and WHO believes, that this is a time to trigger that provision and waive patent rights. We thank South Africa and India for their proposal to the World Trade Organization to waive patents on medical products for COVID-19 until the end of this unprecedented pandemic. Next week, WHO and our COVAX partners will meet with partners from governments and the industry to identify bottlenecks in production and discuss how to solve them. To speak more about the potential for technology transfer, today I'm delighted to be joined by Dr. Mary Paul Kinney, the chair of the Medicines Patent Pool Foundation. Mary Paul is no stranger to WHO. Until 2017, she served as WHO's Assistant Director General for Health Systems and Innovation. She is now the Director of Research at INSERM, the National Institute of Health and Medical Research in Paris. Mary Paul, it's always a pleasure to welcome you back to WHO. You have the floor.
Thank you very much. Thanks so much, Dr. Tedros. As usual, it is a great pleasure to come to WHO, albeit virtually, and to contribute to the work of the organization. As requested by President Macron of France when he recently convened the principles of Act A in trying to address production issues, what is clear is that we need to be looking at what can be done now in the short term, while we are also looking at the longer term. So as you said, in the short term, while manufacturers with vaccine currently approved seem to have secured capacity to fill all the bulk vaccine they can produce, there are many other products which are in the process of being tested or considered for approval, for which the supply of bulk vaccine is likely to exceed filling capacity. For these manufacturers, access to filling line at drug facilities around the world may greatly increase output. Then there is a medium-term strategy. Existing manufacturers have already established a number of bilateral technology transfer agreements, and many of the vaccine registered in at least one country are already being produced or are in preparation, therefore, for production in other countries. While this is enabling an increase in the global supply, this supply still falls short of demand, and this activity must be increased. And finally, there is a longer-term strategy which will draw from the experience of WHO with influenza vaccines. Those of you who knew me in the years 2006 to 2017 know that this technology program, now headed by Martin Friede, remains one of my legacies at WHO. Under the leadership of WHO, many partners would need to be involved in this work, including many that are already active in COVAX. The Medicines Patent Pool is pleased to support this three-pronged approach by leveraging our close relationships with generic manufacturers across the globe to help identify suitable partners to fill and finish needs and potential recipients of technology transfer. And of course, we have a long experience of the licensing process, which will be needed to facilitate this partnership and allow that the licenses we shall issue maximize the benefit to global public health. More distributed manufacturing has been pushed front and center by the pandemic. But this is something that we need to address anyway if we are to improve both supply security and the green agenda drive for shorter supply lines. Once again, the pandemic is forcing us to both think outside the box and to move beyond the status quo. And this is what is on the table today. Thank you, Dr. Tedros, for pushing this agenda forward. And Christian, back to you.
Thank you, Mary-Paul, and thank you so much for your continued support and collaboration. Merci beaucoup. And Christian, back to you.
Thank you, Director General, and thank you, Marie-Paul Kini. With this, we open the round of questions. I remind everyone to raise their hand with the raise your hand button, and then, of course, to unmute yourself when it's time. And only, please, one question per person. We'll come back to you in case we have a second round. So with this, I call upon Kamran from Azerbaijan Real TV. Kamran, please go ahead.
So, thank you, Christian, for the connection. Do you hear me?
Very well, go ahead.
Thank you so much. WHO is one of the founders of the platform COVAX, but we have information delivery of vaccines within the platform COVAX is delayed to many countries. One of them, Azerbaijan. Our government, paid $21 million to these vaccines, but at this time, we didn't receive vaccines from COVAX platform. We asked questions to them, but they refused to answer our question. How can you explain it? When we will receive vaccines by the platform COVAX? Thank you so much.
I'll hand over to Dr. Swaminathan, please. Or Dr. Aylward, please go ahead.
Thank you very much, Christian. We're at a point now with the start of the rollout of COVAX, which comprises 190 countries, in which obviously not every country, unfortunately, can be served at exactly the same time. So one of the great challenges has been, how do we make sure the available vaccine is allocated as rapidly and as efficiently and effectively as possible? And there's a number of challenges to getting from what we call the emergency use listing or licensing of a product right down to its use in the country. And this involves activities that have to happen at the international level with the suppliers as well as at the country level. And some of the biggest challenges that we've seen for countries has been putting in place the regulatory authorization for these products, as well as what we call the indemnification and liability provisions for the use of these products. And the regulatory authorizations have to be in place, the indemnification processes have to be in place, the national vaccine plans have to be in place, and then once all that's in place, we've got to be able to link it up with the shipments, the logistics, the purchase orders, etc. So it's quite a complex process, and what we're trying to do now, and you'll see on various websites, make as transparent as possible when we think the products will be able to arrive and when countries are fully ready to receive them. So on the UNICEF website now, they've put an excellent site with a map that shows and the delivery dates for the upcoming shipments of vaccines. On the Gavi site, the COVAX site, you can see when they've actually rolled out. But while we're not in a position, especially through a press conference like this, to talk about the specifics of any one country, usually it's a combination of the factors. Now, the good news is that these factors that I just mentioned around indemnification, around regulatory authorization, the plans, getting the purchase orders in place, these things are getting worked out for almost every country. And now of the 190 countries that are part of COVAX, we're down to only, I believe it's 24, about 24 where we don't have all of these pieces in place. For the other ones, it's simply a matter now of making sure that the manufacturers can keep up with the schedule of shipments that we're putting in place. So if all those country-level pieces are in place, the vaccines have been reserved, it's just the time, and it may take a week, it may take 2 weeks to actually get the packaging, labeling, shipping in place to get them into your own country.
Thank you.
Thank you very much. With this, I call upon Michael Boshukius, sorry for the pronunciation, of CNN. Michael, please go ahead.
Thank you. Thank you for taking my question. It's Michael Boshukius here. I'm a regular contributor to CNN Opinion. My question is, I guess in a way, kind of theoretical one. I know WHO has been, over the recent years, prioritizing mental health. And I'm wondering if we're getting to the point in the pandemic, especially in developed countries, where there's now a concern between, of course, the pandemic and the sickness that is happening, but also the impact on mental health, especially when people are on kind of the end of the rope in terms of hope. Many are losing their businesses, many have been furloughed. And my question is the following: do you think that government should now be perhaps in their calculations on reopening, taking more into account the economy and the impact on mental health? And I'll give you a quick example. Egypt seems to be a country where they put more of a priority on the economy and not downgrading public health, but putting a lot of emphasis on the economy, because a lot of the economy there is made up of small businesses. So should governments kind of be recalibrating in order to prevent a mental health crisis up the road? Thank you.
Thank you very much, Michael, and apologies again, and I'll hand over to Dr. van Kerkhoven.
Thanks very much for the question. It's an excellent question, and the answer is absolutely yes. There's a lot of work that the organization is doing looking at mental health, and we have been for years, but in particular with this pandemic, really recognizing the incredible toll that this has taken on every single individual, no matter where you live and no matter what age you have. There are variations in terms of the impact that this has had on individuals, whether you have lost a loved one or a family member or a friend to this virus, whether you've lost your job, children who haven't been in school, people who are forced to stay home in very difficult situations. The organization, through our Department on Mental Health, has been working to find ways in which we can support people through this. But it goes beyond the acute phase of where we are right now, but also thinking long term. So absolutely, there needs to be a lot more emphasis by governments, by communities, by families, by individuals to look after our well-being. Some of that we can do ourselves, but some of it we need support. And just to also say, for anyone out there who's feeling the pressure of this, and of course all of us are feeling that too, if you need help, please reach out. And those of you who have friends and loved ones who you know are struggling, also reach out to them. Every day, you should make a phone call, make a connection with individuals to reach out and make sure people are okay. Ask the question once, are you okay? Ask the question again, are you okay? And find ways to connect. We say physically distant, not social distancing, because we want to make sure that people remain socially connected while they are physically distant. And we also recognize the duration of this pandemic in our 14 months now, without having the hope of vaccines and vaccinations, and that should definitely be a sign of hope. Other signs of hope are that we can control this virus. We can bring transmission to its knees with individual level measures supported by communities, leaders at different levels. We have some power in that. And find ways to find joy every day, no matter what you can do, whether it's making that phone call, making that connection, listening to some music, getting some sun on your face if you can. Find ways to smile every single day.
Thank you very much, Dr. Ryan.
Going beyond the absolute impacts of the disease itself on people and on families and the mental health strain of having a loved one ill and not being able to see them in hospital, and the terror and the tragedy associated with that, the mental stress that frontline workers, health workers have been under, communities and so many others have been under. It's one thing to say that mental health is and psychological health is under pressure. That's true, but it's also the opposite of that has to be what we're doing to support and provide psychosocial support to people and communities. And I think that's what we really need to talk about, not measuring. We need to measure the mental health impact and understand truly what's happening, but I think there's a point where it just becomes unethical to continue to call something out as an issue, but not actually focus on solutions for people and communities. And I'd just like to recognise the work that Deborah and Mark and the people here do in the mental health programme. They've been outstanding. This has been a Cinderella area in health, in public health, for too long, and certainly in the work that we do in humanitarian settings, mental health and psychosocial support is a huge part of humanitarian intervention, and it's a very practical issue. If individuals and communities are not physically and mentally healthy, it is very difficult to absorb the strain and stress of an epidemic. It is very difficult to sustain behaviours that stop the epidemic. There's one thing this virus seems to love, and that's despondency and incapacitation of our ability or willingness to stop the virus. And I sometimes wonder whether it is that impact that is the most profound. And when it comes to recovery plans, and as we all hopefully begin to look in this year, I hope, at how we're going to recover from this pandemic, the mental health and psychosocial support to individuals and communities must be central to all recovery plans, and it must be costed in to those plans.
Thank you. Just would like to add a bit on mental health. I think all has been said, just one dimension only. As the world remembers, may remember, it's a long time now, after the Second World War, the world has experienced mass trauma because Second World War affected many, many lives. And now even with this COVID pandemics, with bigger magnitude, more lives have been affected. Almost the whole world is affected. Each and every individual on the surface of the world actually has been affected. And that means mass trauma, which is beyond proportion, even bigger than what the world experienced after the Second World War. And when there is mass trauma, it affects communities for many years to come. So the mental health problem, it's not an issue of just current, like during the pandemics, but even for many, many years to come. And countries have to see it as such and prepare for that. And WHO will support in any way possible to address the mental health as a big proportion, which is the mass trauma. Thank you.
Thank you, DG and all. With this, we come to Jeremy Loesch from RFI. Jeremy, over to you.
Yes, thank you, Christian. Hello to everyone. A quick one about the report of the interim report that was scheduled for the Wuhan mission. It seems like it's not going to be available anytime soon, and I was wondering if it comes as a personal disappointment for you.
I believe we have Dr. Peter Ben-Embrek online. In this case, would like Dr. Ben-Embrek to take this. Peter?
Yes, I'm here. Can you repeat the question, please?
It's basically about why the interim report was not will not be issued, but when will the final report come over?
Yeah, we decided to go for the publishing and issuing both reports at the same time, both the summary report and the full report, because they follow each other and it makes sense to issue them together at the same time. The current timing is that the week of the 14-15 March, which is not next week, but the week after, that's where we plan to be able to release the report during that week. We don't have yet an exact date, but we are working on that week.
Jeremy, does this cover your question?
Well, mostly I would like to know why. I understand it makes more sense, but what is the main reason for postponing the release?
Thank you very much. I'll hand over to Dr. Ryan for this.
Peter, just to clarify, there was never a plan, I believe, for an interim report, first of all. There was hope that we would get a summary report out. Given the interest in this area and given the tremendous demand for detailed information, and we saw that with a huge and understandable demand for that information, the team itself felt that getting the full report done, the full report could have taken a lot longer, and what the team have done to their credit is really worked hard to try and come up with their full report so we can have a proper discussion around a full report rather than having two discussions, one on a summary report where you'll ask all the questions that need to be answered in a full report. So there was no scrapping of an interim report. There was never a plan for an interim report. This is really trying to facilitate a good discussion with the international community, with media, with public, around what will be a full report, and then we can discuss where we go from there. The Director General will receive that report from the team, we hope, in the near future, and obviously we will respond to the recommendations in that report.
Thank you very much, Dr. Ryan, for this important clarification. With this, we go over to Helen Bransfield from Stat News. Helen, please unmute yourself.
Thank you, Christian. I was hoping we could get an update, please, on the outbreaks, the Ebola outbreaks in DRC and Guinea. Thank you.
Thank you very much, Helen. And as we have Dr. Sose Fall online, I'll hand over to him. Over.
Okay, thank you. Thank you, Ellen, for the questions. As you know, we are fully involved in supporting Guinea and DRC to respond to Ebola outbreak, in addition to the response to the COVID-19 pandemic. In DRC, so far, we have recorded 11 cases, including 3 new cases over the last week. And we are implementing all pillars of the response, using a community-based approach, making sure that also we implement the ring vaccination, contact tracing, and treatment of patients using the available therapies. So far the situation is stable, but as you know, the risk is still high for expansion to other health areas or neighboring countries. The situation in Guinea, in terms of number of cases, we have now 18 cases reported in the zero COVID area. Over the last week, we have recorded 8 new cases. So the response is also ongoing. We have a number of contacts identified, and we started implementing the ring vaccination a week after the beginning of the outbreak, mainly one day after the vaccines arrived in the country. It was really important because we have the capacity in Guinea to conduct ring vaccination. Most of the experts in ring vaccination, even in Congo, were deployed from Guinea. So we are using this local capacity in addition to the people we deploy. We have around now 100 people deployed. As you can see, Dr. Michel Yao, who is the Director of Health Operation, is right now in Guinea, in Zero COVID, reviewing all the pillars of the response to make sure that with partners we are on track using our key performance indicator. But we are not only working with Guinea, we are working with all the 6 neighboring countries, improving readiness based on our assessment, and I'm sure Michel can add more on this.
Yes, and Dr. Michel Yao, who, as we heard, is in Guinea right now. He is Director of Strategic Health Operations. Please go ahead.
Yeah, thank you very much. Speaking from Zerekore, close to Cote d'Ivoire and Liberia border. So this is what actually increased the threat of spread to all these neighboring countries. In Guinea, on Tuesday, we had a quite good meeting with ministers coming from neighboring countries, and we agree on some of the process to increase preparedness, because from our assessment, countries were more or less half prepared. This is higher compared to 2014, but we still need to quickly work on some of the response areas, mainly for testing, to ensure that regulations are updated, people are trained for vaccination as well as new therapeutics. This is the key element in this response innovations that we need to bring to people that at least have some experience from the last outbreak. So all these countries agree on information exchange and also to prepare themselves for this innovation, to ensure that they have also simulation exercise, but also make sure that they more and more have a sustainable system within the health system to deal with Ebola that could be recurrent based on the increased contact of the human being with also different forests. Now in Zerekore, where I'm based now, the good thing is that at least all the response areas have kicked off. Now we need, with all the partners, to collectively scale up and ensure that we have a comprehensive and very sensitive alert system, that we have also capacity to quickly isolate, confirm and isolate cases, and we have also a capacity to ensure infection prevention and control. This with the community, because this is the critical part. Working closely with the community is a part of also lesson learned in Eastern Congo. So all this process are ongoing. In DRC situation is more or less stable, but here in Zerekore, too early to say. We had one case yesterday, and we need to ensure that all the components are up to speed. So this is what we are doing as WHO and all the experts deployed on the ground. Over.
Thank you very much, Dr. Fall and Dr. Yao. With this, we move to Sarah Teofilo from Correio Brasiliense. Sarah, please, unmute yourself.
Hi, thank you for taking my question. We are seeing here in Brazil a change in the profile of ICU admissions. Before, the patients were older, and now the authorities from Brazilian states say they are seeing younger patients in the ICU. I'd like to know if this has been seen in other countries, and what could help explain this change in the profile. Could it have anything to do with the variants? Thank you.
Thank you, Sarah. Let me hand over to Dr. van Kerkhoff, please.
Thanks, Sarah. Thanks, Christian. I will begin. We have seen similar patterns in other countries where there's a slight shift in the age profile when we have additional waves of infection, additional peaks of infection in different countries. Part of this is due to the nature in which populations mix. In some countries, when interventions and stay-at-home measures and other measures have been lifted, the first groups to lift those measures tend to be younger individuals heading back to work and whatnot. And we see a shift in the epidemiology because those who are out and about tend to be younger, and those are the ones that are getting infected. And we have seen, with increasing case numbers in individuals, you will see increased hospitalizations and you will see increases in ICU. So that is something that we have seen in other countries. And if you remember, in the beginning of the pandemic, most of the cases that were being detected were severe cases, because this, at the beginning of any epidemic, any pandemic, is focused on those who seek health care. And so most of the individuals who are identified as cases in the beginning of any outbreak tend to be older, because they're the ones that are at risk for higher risk of severe disease, and those are the individuals who seek care. With the situation in Brazil and in other countries that are seeing increases in cases, and we are seeing, you mentioned the variants, there are different virus variants that are circulating. The 3 virus variants that we are tracking, the B117, the B1351, and the P1 that is circulating in Brazil, is associated with increased transmissibility. There are some preliminary studies that suggest that there's increased transmissibility. If you have increased transmissibility, you will have increased case numbers. You'll have increasing numbers of patients that will require hospitalization. You'll have increases in those that are developing severe disease, and that can have an impact on the burden of the healthcare system, which can result in increases in deaths. And unfortunately, we have seen that in a number of countries as well. The best thing that we can do right now, even with these virus variants, we know that the public health and social measures work against these virus variants, including the infection prevention and control measures in healthcare facilities as well as outside of healthcare facilities. So the best thing that we can do now is try to drive down transmission everywhere we can, and prevent as many infections as we can, so that we don't have as many cases that are progressing to severe disease and death.
Dr. Ryan, you want to add?
Well, just to emphasize what Maria said, there's clearly been a nationwide increase in Brazil, and that's north to south. And that Manaus and Amazonas was really in a very, very difficult situation quite recently. The number of cases and the intensity of that has dropped, but the problem is still very, very much there. And even in Amazonas right now, we're still talking about 80% plus ICU occupation, and overall COVID-19 bed occupancy is nearly 60%, and that's in the context of falling numbers. So that pressure is still there. But what we've seen is similar patterns starting to emerge in other parts of Brazil, particularly in the northeast and even all the way down to the south. We see similar patterns. What Maria said, I think, is key. The public health and social measures, the behavioural measures, stop all of these strains or variants. And we really do. Now is not the time for Brazil, or anywhere else for that matter, to be relaxing. And I say this, I have the same feeling myself. The arrival of vaccine is a moment of great hope, but it potentially also is a moment where we lose concentration. If I think I'm going to get a vaccine maybe in the next few weeks or the next 6 weeks or the next 2 months, maybe I'm not so careful anymore. Maybe I think I'm through this, right? You don't need a whole lot of people to start thinking like that we give the virus opportunities to spread. We saw that in Europe. We saw that coming up to the Christmas period. Small changes in the behaviour of a large number of people can lead to huge changes in the epidemiology of this virus. I think we need to have learned that by now. So when we change our behaviour, the virus changes in terms of its capacity. So we need to adapt our behaviour carefully, systematically, and we need to be very careful when exiting public health and social measures, however difficult they are. The states and the municipalities there's 5,600 municipalities in Brazil, I think. Mariangela will tell me if I'm wrong. It's a complex country. Each and every one of those municipalities is unique. They're all fighting very, very, very hard, and they all require, and the states and the government of Brazil require our full support. But the story in Brazil can be and will be repeated elsewhere if we stop implementing the measures as we need to implement them. We need to support communities to do that, not criticise communities who do that. And this is going to be the case in the Americas, in Europe, and everywhere else. The process of realising the benefits of vaccination are going to be about doing the other things really well. Keeping up our own personal behaviour, maintaining public health measures where we need to until we're sure we can control the disease, getting our public health and surveillance measures back in place. Many countries have stopped doing case finding and contact tracing because they've had such intense community transmission. Well, are you ready to start again as these numbers fall, as vaccines start to get rid of the deaths and of the hospitalizations, and the pressure comes on to open up again? Are governments ready to go back to doing cluster investigation, expanding testing, extending rapid testing to as many people as possible? These are the things we're going to have to put in place if we're going to exit the kinds of lockdowns and the kinds of measures that have all affected our lives so much. We need to put in place strong continuation of our own behaviours, strong surveillance, very powerful vaccination for all who need it. And if we get those three things right, then I believe countries can begin to think about how they exit these very severe public health and social measures. And I'm really concerned right now, I really am very concerned, that all of us, governments and individuals alike, think in some way psychologically, and I understand what's driving that. We think we're through this. We're not. And countries are going to lurch back into third and fourth surges if we're not careful. I hate to be the party pooper here, but that's unfortunately the way I see it. And we should not waste the hope that vaccines bring. We should not waste the precious gift that vaccines will bring by dropping our guard in other areas. It's really, really important.
I fully agree. The situation in Brazil is very, very concerning. If we check the figures, maybe compare what the number of cases were in November 2nd, the week of November, to 114,000. And it has been continuing to increase constantly and reached now, week of February 22, around 374,000 cases. And it's not the number of cases. If you take the number of deaths, in November, the week of November 2, it was 2,538. In February, the week of February 22, it's 8,000 deaths per week from 2,500, constantly increasing again. When we saw some declining trends in many countries the past 6 weeks, the situation in Brazil was either on the increase or just plateau. But of course, more of a tendency to increase. I think Brazil has to take this very, very seriously. And as my colleagues said, while doing everything to roll out vaccines, but in the whole country, aggressive use of the public health measures, social measures, will be very, very crucial. Without doing things to impact transmission or suppress the virus, I don't think we will be able in Brazil to have the declining trend. So I'd like to underline that the situation is very serious and we're very concerned, and the public health measures that Brazil takes should be aggressive while also rolling out vaccines. Thank you.
Just one thing I forgot to add, because I think the journalist asked this question about the variants. There are many variants that have circulated in Brazil, but the P1 variant has become dominant. We are concerned about the P1 variant. It carries some very specific mutations that confer on the virus very particular advantages, particularly around transmission. And there is no question that it has added to the complexity of the situation that Brazil faces. And equally, Brazil would have been one of the areas, particularly around Amazonas, Manaus, that had intense previous outbreaks. So again, there is no question that a proportion of these cases that are occurring now are reinfections, potentially due to waning immunity or due to the fact that the virus, new variants may be evading the immunologic protection of natural immunity, which in itself means we have to be very careful with vaccines and ensuring that the vaccines work against these strains. It's really important, for example, there's a really, really good genomic sequencing network in Central and South America. We need to support those networks now to do really intensive genomic sequencing, to share that information, to link that information to the metadata around clinical and epidemiologic factors. We need to be able to support those superb scientists, and I've seen some wonderful presentations over the last couple of days. There's some excellent papers in preprint, really around the situation in Brazil and surrounding countries. So South America in particular, and the scientists in South America, deserve our full support to fully understand the dynamics, because this is important for the rest of the world. We need to fully understand the disease transmission dynamics, the variant dynamics occurring in Brazil and in other countries, so we can fully understand the implications of this going forward, both for our control measures and for our vaccination and diagnostics. But what we can say, based on what we've observed, is that the public health, the behavioural measures, the things that protect you against the original strains still protect you and your community from P1 strain or any other strain. It is still our best bet. Unfortunately or fortunately, it is still in our hands. Our risk, to an extent, is in our hands. But it's very hard for communities, particularly in countries like Brazil, where you have large urban populations and people may not have access to services. It's very hard to ask people to physically distance and wear masks and do all of these things when they don't have the resources to do that without the support of the state. So I think this is a moment where all countries need to re-examine how much support they're giving to communities to sustain these behaviours. Thank you.
Yeah, sorry for coming back again, but always maybe just one more last thing. You know, the situation in Brazil, of course, we said we're very much concerned, but the concern is not just about Brazil only. You know, Brazil neighbors almost the whole Latin America, many countries, I don't know, except 2 or so. Means if Brazil is not, serious, then it will continue to affect all the neighborhood there and beyond. So this is not just about Brazil. I think it's about the whole Latin America and even beyond. So there should, application of serious public health measures is very, very important.
So as it's such a hot issue, let me hand over to Dr. Swaminathan as well.
Thank you, Christian. And yes, I just wanted to add the point to what's already been said about trying to understand more about the disease. You asked about, young people being in ICUs and what could be the potential reason for that. We've learned a lot about this disease, and it's happened because of international collaboration and sharing of data and information. We have, the WHO has a patient clinical data platform that we encourage countries to, encourage doctors to provide the patient information. Currently, I think we have 80,000 patient records there. So what the advantage of a system like that when we share data globally is we start understanding much more about the disease. What we know about the risk factors, for example, one of the major risk factors for severe illness is obesity. And unfortunately, many countries in the Americas have very high obesity rates among adults, as do other parts of the world. And so that is definitely a risk factor. Even if you're young, if you have obesity, then you could be at risk for severe illness. So by pooling data from different parts of the world, from patients at different stages of the disease, we understand much more, and that can then be applied to trying to protect them at an earlier stage. We had a meeting here on Wednesday, on the 6th, to discuss the gaps in the knowledge about therapeutics and why therapeutics has not advanced as much as vaccines have. When we find ourselves in a situation like this where lots of people in the hospitals and you're trying to save lives, it's not vaccines we need, but it's treatments. And really there are only a handful of things we know that work. We know dexamethasone works in people who require oxygen or mechanical ventilation. So we hope that that's a standard of care in all countries now. WHO did the guidelines for corticosteroids way back in September of last year. Since then, we've provided recommendations, mostly negative recommendations on hydroxychloroquine, on lopinavir, ritonavir, and we're currently looking at the IL-6 inhibitors, for which there is some emerging evidence from trials, as well as drugs like ivermectin, which still has very poor quality evidence, but our guideline development group is looking at it. We're constantly updating our clinical management guidelines. It's a living review, a living guideline. Every time there's new evidence, it's put on there. This will help clinicians and those who are looking after patients to provide the best available care. But again, we need a focus on developing better treatments for COVID-19 because, you know, we will have the vaccines, we will have people covered with vaccines. Hopefully we will reduce significantly the number of people who get ill, but there will still be people who catch COVID and who get ill and would need to be treated. So again, a call for more global collaboration. We haven't advanced as much on treatments as we have in vaccines. We need drug developers, we need academics, we need global funding agencies to support this area of work. And Brazil is a leader in research and innovation. It has several very strong institutions, and they can contribute to this global quest. Thank you.
Thank you very much all for these important points. With this, we move to Christophe Vogt from Agence France Presse. Christophe, unmute yourself, please. Christophe Vogt.
Good evening. Thank you for taking my question. Just one remark, if I may. There was talk of a preliminary report from China experts on February 12th. But my question is about production. I was just wondering, there have been several deals that have been made in the last couple of weeks, Sanofi, Merck, with Johnson & Johnson, and Pfizer. Do you have any idea how much those deals represent in rise of production? And I would just like to, if you could give us a little bit more information on the summit on production that you're going to have next week. Who will be there and what is it going to be exactly about? Thank you.
Thank you, Christophe. And Dr. Swaminathan, please.
Thank you for that question, Christophe, and perhaps Dr. Keeney might want to add. For your first question, we haven't seen the data on what those increase in volumes are going to be, but it's very welcome. This is exactly what we want to encourage. As the Director General pointed out, there are several mechanisms by which we can increase supplies in the short term. This is one of them. Making those deals or collaborations between companies, the one that's producing and has the raw material and the supplies of the bulk, and the other one that does the finishing and filling, can definitely serve to increase. So it's very welcome, and we would like to see more of this happening in more parts of the world. We need to explore the fill and finish capacity in Asia and Africa and Latin America and use those facilities to increase supply. On the summit, this is being convened on Monday and Tuesday, 8th and 9th. It's by the COVAX partners, so CEPI with Gavi and WHO, but also with the International Federation of the IFPMA, pharmaceutical manufacturers, and the Developing Country Vaccine Manufacturers Network. It's essentially to look at, it'll have government representatives, companies, as well as experts to shine the light on the gaps that we have currently in the supply chain of reagents, of raw materials, of products that you need to make vaccines. And these are things that the manufacturers know what they need. There are global supply chains which are not working so well anymore, as well as the unprecedented demand for things like plastic and glass and stoppers and vials and also the raw materials, the chemicals. All of this will be discussed, so the gaps will be identified, but also what the solutions could be. Where do we source these materials from? And hopefully we can do some matchmaking, find some solutions to fill that gap, because that can make a difference again in the short term, even as we're looking at more medium and longer term. So the summit is really focusing on that upstream area of the gaps, how they can be filled, and for solutions to be found. And then WHO will also continue a stream of work on technology transfer that we're now developing with the partners, where we would like to encourage the transfer of technology, be it mRNA platforms or viral vectors, to those recipients in different parts of the world which might have infrastructure and capacity available, but may not have this particular technology. And so if we can arrange the technology transfer in a voluntary manner through interested parties, we can build capacity not just to make vaccines for COVID, but for other infectious diseases, for future pandemics, to address pathogens which kill a lot of people every year, like tuberculosis. So this is really an area which I think, while the pandemic has provided an opportunity, can have an impact beyond the pandemic. But it's going to require a lot of technical work and of course, collaboration and cooperation from those who currently have these technologies that have been proven to work or that are currently in the pipeline, and transfer those to areas which can accept and become hubs. This will also help to build regional health security for the future. We would like to see production happening in a distributed manner in all regions in the world. So I'll stop there. Maybe either Mary Angela or Mary Paul might want to add.
Yeah, let me look at Dr. Marie-Paul Keeney first to see Mary Paul.
Thank you. Thank you. Just one comment, I think that Soumya covered it very extensively, is that we need to move beyond just IFPMA. So it's excellent that IFPMA companies help each other, but we need also to go beyond. And there are many generic drug manufacturers who have a high record in terms of being able to operate under good manufacturing practices, which could also help on this process.
Dr. Simao, please.
Just to complement, because we are talking about increasing capacity for increased number of doses, availability to the world, which is excellent. So these bilateral agreements and the all movements to increase capacity are welcome. However, we would like to see more of a commitment to equitable access, right? That once these vaccines are available and there's an increased capacity, that they don't all go to high-income countries, right? That there is a commitment, a strong commitment to ensure that the COVAX facility has access, and because through the COVAX facility we have a mechanism to make these vaccines go to low and middle-income countries, upper middle-income countries, everyone in this planet. So it's very important that this type of increased capacity helps to the world to achieve greater equity. And the DG has called, our Director General has called many times for industry to commit to ensuring that there is equitable access to the vaccines that are produced. So it's a very good point. Thank you.
Thank you very much, and thank you very much also, Dr. Keeney. We have time for one, maybe two more questions. Oh, no, we have one more question, right. And then we change continent. We go to Latika Book from Sydney Morning Herald. Latika, please.
Thank you so much to be lucky last, much appreciated. And just to push the friendship, I'm going to ask two questions. Dr. Tedros, you will obviously have seen this letter by the 24 scientists saying that they believe there should now be an investigation held independently of the WHO's own probe because they don't have confidence in what the WHO has been able to unearth in China. Would you agree with that? And secondly, you no doubt saw Italy blocking supply of vaccines to Australia. They have cited the reason being that Australia has eliminated coronavirus, so it doesn't need the vaccines as swiftly as possible. Is that, in your opinion, a fair and reasonable excuse and justification for blocking supply of vaccines to other countries? Thank you.
Dr. Ryan, please.
On the specific issue of the the letter from scientists on China. Yes, I mean, it is as ever, thankfully, a free world, and scientists and others are encouraged to speak out on all matters that they feel they see fit on. Just to remind you that the missions to China were part of a scientific and collaborative effort that the Director General was asked to undertake in consultation with the 194 member states of WHO. And he has done so bringing together a multinational, multidisciplinary team that have in good faith worked, spent a great deal of time and a huge amount of effort to go and advance our knowledge regarding the possible origins of this virus. As we've said previously, progress has and is being made. Nobody is declaring successful outcomes as yet. We await the report of the team. We thank them for their hard work and for their acumen, and we will await that report. In parallel, if others want to call for anything else, they're perfectly within their rights to do so. I would, though, suggest that people maybe just take a few days to wait and examine what the outcomes are. There will certainly need to be more work. There is no question, and that was envisaged in the resolution of the World Health Assembly. And again, let me remind you, the World Health Assembly is a meeting of 194 ministers of health from around the world. That Health Assembly envisaged scientific and collaborative missions. It was in the plural. There was a fundamental understanding, even at that time, that it was going to take time and potentially multiple missions to fully understand this. We have said this again and again in the past with regard to previous emerging disease outbreaks, that it is very difficult and sometimes takes years, if not decades, to understand disease origins. I've alluded to Ebola, in which we don't fully understand yet the origins issues in Ebola. We don't understand all of the pathways into humans. We certainly don't understand that for SARS-1. We don't fully understand that for SARS-CoV-2. This is a process of discovery, and it is a process of working in new ways with all countries. And as we come together to try and face these pandemic threats, I think we all have to recognise that all of us have to do better in terms of how we collaborate and how we share and how we face these common threats. It's a journey of learning, a journey of solidarity, and I believe that the mission will demonstrate progress, and the Director General will receive that report, and he will have his view as to what further work needs to be done, and that will be reported to the Assembly in due course in May. Thank you. But Bruce, I don't know if you want to take the issue now.
Thank you, Mike. Maybe I'll just add a bit because she wants to hear from me too. So you have covered almost everything, but just a bit. As you know, when any outbreak happens, forget about a magnitude like what we have now, a pandemic. Knowing exactly what happened is the basics of public health. And as actually a public health expert, I have done it myself many times, going to the field, understanding what happened when we encounter outbreaks so that it will not repeat again. And with the magnitude of this unprecedented pandemic, it even makes it even more important to understand exactly what happened and what the origin is, because we need to understand that so it won't happen again. And for that, the crucial thing will be transparency. So what I would like to assure you is that you will know. We're waiting for the report. I'm waiting for the report like you. I don't have access. Still waiting because these are independent experts. Then you will see for yourself. But what I would like to assure you is that everything that happened during the trip will be presented transparently. So I assure that there will be transparency and see exactly what happened, what were the gains, what were the challenges, and then where do we take it from here. So that's what I would like to assure you. and because that's what is going to help the world. Transparency, openness, and see exactly what happened and learn from it. Thank you.
Thank you very much, both, and Dr. Tedros. We overshot time and we covered a good amount of questions ranging from Ebola to COVID and others. So before I hand back over to Dr. Tedros for the final comments, let me remind everyone that the audio files and the remarks of the Director General will be sent right after the briefing. The full transcript of the briefing is available tomorrow morning on our website. Any other follow-ups, please direct to mediainquiries@who.int. I want to thank our special guest, Dr. Marie-Paul Keeney, today, and of course everybody who participated and you online. Dr. Tedros.
No, thank you. Thank you very much, Christian, and thank you to all who have joined today. And look forward to seeing you in our upcoming presser. And have a nice weekend, I think. Bon weekend. Yeah, thank you.